Hi everyone, I am Roxana Damas, and this is my PCOS story. Where I started was a lot of confusion, a lot of pain, a lot of disorganized symptoms in my body in my early teens, and where I'm now, finally getting to understand how my body functions and officially seeing results from all the work I've done all these years. Interesting enough, I think without knowing later in the years, the symptoms started as early as 8 years old. And the reason I know this because somewhere in my bank of memory, there's a conversation my mom had with one of the doctors. And he had said to her, you're really going to have to start talking to her about having probably her period really soon. She's like, what? She's 8. And my body was just showing all the signs that I was developing faster. And there was obviously some kind of weight issue, and I wasn't obese as a child, but there was definitely, I had gained some weight. And so there was that concern. So that was about 8 years old. Fast forward, never made sense to me too much later until I knew that I was diagnosed. And once I turned 11 years old, I had moved out of the country. My parents had sent me to live with my grandmother for a while, and they were going to move back home to their home country in El Salvador. And I started noticing a lot of shifts just kind of in the losing weight easily, just kind of the food I was having and everything. And all of a sudden I got my period the first time. And when I did, it came maybe like a January, and then it disappeared completely, like around till September of that same year. In my teen years, I guess the most notable thing was the weight was not an issue. Mostly because I think since I was out of the US, I think a lot of the food was a lot more organic. I walked a lot more. My entire environment was a lot more peaceful in terms of like my day to day, and my eating habits were quite different. But what I guess was the worst part is just how irregular my periods were and how painful and debilitating they were, and I couldn't really function. So I had no one around me having that experience, and I just kind of remember nurturing myself as much as I could because I really couldn't really talk to anyone about it. So it took many, many years till after I moved back to the States where I noticed something was off, because I was like, isn't my body supposed to naturally do the month-to-month period? So I asked a doctor, and they're like, oh, we're just going to get you on birth control. So I think right about age 14 or so, they put me on birth control. So from age 14 to like probably 20 or so, age 20, I was on birth control. But the thing is, I started getting involved in different things in college. I started college really, really young. So I was about 16 when I started. And then I started feeling some really weird symptoms right around when I hit 20, 21. And I stopped taking them. But then my weight really started fluctuating a lot. I could say I had a lot of numbness in the legs, a lot of weird things that were symptoms that you would normally read on the back of one of the birth control pills. I'm like, is this normal? And I was performing. You may have seen in some of my Instagram posts that I'm a singer. And so at that time, I was really at the peak of me trying to perform. So I was literally performing every day of some sort. Either I was training or I was actually on stage giving a show. So it was no logic to me that I was gaining so much weight. And there's one thing I should say. Every time I would come on vacation when I was living in El Salvador and I'd come back here, I would gain a pound a day almost by the time I would get back home. And so it was really weird that I would, come here for 30 days and all of a sudden I was like 20 pounds overweight, and I would have to lose it again when I would go back there. So once I moved here and I started in college again, it was just a real weird kind of setup for my body and just kind of what was happening. When I started performing, I just couldn't understand that it was very noticeable how heavy I was getting. And that's really the first time I saw a big fluctuation with my weight. And there was no reason for that. My food intake was pretty normal, everything else. So I just could not figure it out. And it was like, everyone's like, just stop eating or stop doing certain things. And I'm like, it was not working. I did not have the best eating habits. I over exercise. I underate. Or at times I thought, I was like, oh, I could have a burrito with the guys. The rest of the musicians, I'm like, they could. I couldn't. It was just not working well. So that just led, and I'll stop after this one. It led to a very early bad conversation with one of the, I won't say the name, but it's one of the women provider clinic providers, because I went to the clinic and I said, look, at this point, I'm like at my second or third year of women and gender studies. So I'm really like into the advocate world. And I'm just like, what is going on here? And I went in there and I said, look, I need my body to function and this is not what it is. So can you please get me off of this birth control? I'm feeling these things impacting my body. And then so the nurse practitioner called another nurse practitioner to eventually they bring the head of the clinic to come meet with me and switch my birth control and pretty much like push me that you must be on a birth control pill. And I'm like, at this point, there's me and like four of them in this little room, kind of like where I'm at right now. It was super claustrophobic and abusive. I'm going to take emotionally abusive. Like I didn't know what I was talking about. And so I grabbed the bag because they just wouldn't leave me alone. But once I walked out of there, I said, you guys just answered my question. There is something wrong and you're not giving me the answer. And I'm going to stop taking the pills. That, of course, led to a lot of craziness in my body that I now found out that probably had something to do with it. But I know now why they were pressuring so much, but they never diagnosed me. The diagnosis didn't come till after all the weight had been gained that I had never had in my body until other things started happening. It was this combination of feeling dismissed, like what I knew or what I was trying to share was not being listened to also being in a space where you were being pressured to do something that you don't want to do. And it was just like, we're the medical people. You don't know what you're doing. You're a young girl. You don't know. And then also the stories of like different levels, whether it's socioeconomic or ethnic background, whatever, being women of color in the medical space has also been very challenging all the time. So it was really interesting to have that also. And I come from a family who's always like, go find a solution if there isn't one. So it's not like I'm just going to sit there and wait. I knew something was wrong. I just wish I probably would have started sooner to be more active of what I needed to do for me. I just kind of let it go for a while. So I went back and forth like between the ages of, I would say like 19 and 22. And then from age 22 on, then I had to completely stop the pills. And then my body just, and I was also dealing with a lot of stress. So knowing now what stress does to the PCOS body, like no wonder there was just all these things happening with my nervous system. And it was just a lot of the inflammation. I was putting like a lot of the issues around the inflammation being around just the weight. But I don't think I really understood what it was until probably recent years. I also was dealing with a lot of emotional situations, so a lot of depression for a period there. And I think that, because I was having all these stressful things and then I thought it was more because of that. But as, thankfully I ended up having a therapist who really helped me separate things. And she actually did not recommend that I get on any medication. I'm glad because I think it would have also been worse. She's like, there's other ways that you can handle this, go the natural way. And we did work in that. And I can say that was helpful. The part about my periods always being irregular, all of that time was really bad. And then it just started getting worse. So I think besides the weight part, the most significant part is how bad the period changes happen. So I went from like 0 periods to like a couple times a year to eventually having hemorrhaging every time I had a severe emotion swap. So basically, if I was super stressed out or I got upset, by the time I got up and walked from here to like your front door, I was probably already bleeding. From the time that, if I was too happy or something, that there was just weird fluctuations on my body just based on that. And it just to the point where I could not have a normal life anymore. And I was still doing all the things, publicly. People couldn't say it. The most present thing would be like, oh my God, why is she gaining so much weight? Or family would come by the house and be like, she barely even eats. Like, why is she overweight? But it was really one of those. And then, of course, I'm also a performer. So I was like, how I tried to perform for a period there again. I actually was pretty active performing during those stages where I was finishing off college and at my worst with some of these bleeding issues. But And that's also when I find the research about doing the study. So right when things got really bad, I think I went to El Salvador to visit family, and someone said, "Why don't you just see one of our family doctors and see what happens?" So I went to see her, and she tells me, "Honey, I don't understand why in the U.S. they're not diagnosing you. I went to train in the U.S." She was like a top professor for OBGYNs in El Salvador and she in Central America. And she's like, "I trained in the US, I've trained in Europe. If I open a medical book, you are a medical book description of PCOS, all the signs." And so she's like, "This is what it is." She explained to me the basics. I won't say that she gave me too much, and she got me on metformin and a few things. That did not sit well with me. But I metformin, so just like that, yeah. So she got me on that, and it was just not. I wish I would have stayed longer. I think it would have made a difference in her being able to see how my body was progressing, but I didn't. I came back to the States, still had to finish off school. I was still performing. The weight part had just gotten pretty bad at that point. And I think I ended up going to, and that's when I found the research study. So there was a head of a program that was doing study on PCOS and shifting your diet and moving, working with like almonds and swapping different, walnuts. It was like having walnuts versus having other things on carbs. I had to like track every restaurant that I was going to, eating all it was a lot. There was a lot of tracking that was going on in my life at that point. And then once all of the basic stuff was started, then they started doing a lot of blood tests. So this is kind of where it got a little tricky for me because I wish they would have done more explaining. But there was, that they would see how the sugar levels were doing, would be a regular like glucose test, but they did it so much more. Like there was at some point where they would, shoot up some glucose into our system to see how it's actually moving through. That whole experience, for those who have had it done, I haven't heard many people having it done, but it just feels like your entire body's going to burn up. By the second time they did the second part of that test, just to see our progress, that day the kind of checking our blood was just so intense. It was like every minute they would pull blood from you to like, it was literally like every minute. I am not lying. They had a thing there all the time. I came out of there looking like a white piece of paper. I was just done with the life in the world. I just couldn't function. And it was just not, I think the study was great for those who that it functioned for. It didn't work for me. I think I had been bleeding for about 9 months at that point. And I went to see the head of the research project to see my results. And then she said, "Well, you know what, Roxana, you're of the few who didn't have any results from our test. Like you didn't have any changes. Like there was no benefit to whatever they were doing. I guess there were a few of us who didn't." And so since I had heard from the doctor in El Salvador, I said to her, "Look, can we shift me into another treatment and see if there's, maybe other medication or something?" And she said, "Well, unfortunately in the US, the product that she's mentioning is not approved. So you can't have it here. So, and none of the things that we have right now available to treat it are actually helping you." So she's like, you're basically, this is going to be your life. You're going to be months with and you're going to be months without. I'm like, who says that to a patient? Like I could not. At this point, I'm having outer body experiences. I remember driving to work one day and just like feeling like I'm having like my spirit coming in and out of my body just of how bad things were. I was still working and functioning, but I was just a body, but not, and be in severe pain, because anyone who's had a bad period can tell you on, a few days. But if you've gone months like this, you're no longer a human. I'm sorry. Like you cannot even imagine what that feels like. And so I was, let's say I had a break and in between, and I had only a few periods in the year. It still was brutally painful when I did have it. And sometimes it was worse because my body wasn't shedding. So it was like forcing that shed that you would normally have every month. So it was very numbing. Mostly the lower half area, but sometimes entire body. I would have fevers. I would, could not eat and feel like vomiting half the time. A lot of it is like, yeah, I gotta go work, but I'm like literally feeling like I'm gonna pass out. It was just, and it's not something that even disability or other people recognize. In order for it to be recognized, I don't know what it would take, but it's really not when you're at these stages, and it was so debilitating. So I didn't know. I just had to find ways to start shifting the way I worked and the way I did things. Thankfully, I don't know. There's a good thing and a bad thing, because I'm a performer. I'm able to like just go on stage and act like everything's fine. It actually is in that moment, but the minute I walk off the stage is really not. So it's just like I have this ability to get things done, and I still did all the things. And there were days where I was forced to stop. I had to stop. There was no option at that point. And I'm glad that I did, because I think that's part of what was needed. But it's not what doctors or anyone around you really tells you to do. And so at that point, I think I ended up going to a clinic here because I'm so desperate. And I, again, find myself at this clinic, and I'm calling the woman. I'm like, look, I haven't stopped bleeding for days. I need to know that I'm fine. Like, I don't know what to do. Like, can you guys give me an answer? What's my next step? And so I come in, and like, they did not want to test me. So I pretty much pressured them into at least checking that everything was fine and making sure that, I mean, it was a fight. It was a fight all up until the point that I got into the room and they did an ultrasound, and they did, to check that my blood levels were fine and all this other stuff that they would need to look at. But they didn't do it and it was a women's clinic, and they did not. And I also had private doctors. I mean, I had this point had done a couple of things. I had started the first time on acupuncture, but sadly, like, things were so heavy at that point for how I was feeling that I didn't try the alternative medical system long enough. So that doctor, you know, the one from the research said, you know, you should probably just go back to your parents' home country and see if they can treat you there. And that's what I did. I pretty much quit singing, quit my jobs, had started a business at the time, thankfully. And so I was still like having things on the side. And then I left and I went to stay there for a couple of months. But when the first month I arrived, you know, the doctor's like, okay, let's try that medication. I think it's called Diane 35 or something like that. It's some other kind of birth control. And they tried some other thing to reduce the bleeding. Nothing worked. It actually got worse. And so my doctor, when she finally came back from vacation, she's like, okay, we've tried everything that we can. You're just going to stop all medication, all vitamin. You're just going to stop everything. You're only going to eat healthy. You're going to be in bed for the most part. You're just going to relax and do what you can to be at peace. And then we're going to have to do a surgery to cauterize the cyst to see if we can stop some of the bleeding. So that was the beginning of more medical intervention, but it was a brutal couple of months. So I think, yeah, it was definitely about 9 to 10 months at that point, I think. And that's when the surgery happens. I think it's cauterizing the cyst. Is kind of like they drain. I think that's what it is. So they didn't remove or anything. They're just trying to stop the bleeding. Recuperation process after the surgery. It was good. I was surrounded by friends and family, so that part was a good thing to have. So and then obviously shifting, like, you know, she was like you have to relax the body. You have to make sure that you're eating probably just the most clean that you can. And of course, like I told you, I've later come to find out every time I leave the US, the food just seems to do me well. Like it's healthier for me. Like I easily lose weight. There's just the entire experience is different. So, and the one part that was complicated then, and it became apparent that maybe were two things that were going on. So with the PCOS, but then there was, I think it was just in my face after the surgery, was the pain with the bleeding was, it just got worse. So I think whenever I had a regular period, it was just too painful. And that was more the endometriosis. At that point, I got diagnosed with endometriosis too. So I had both. And that would explain that, because I think women with PCOS have a lot of painful periods, but when you have endometriosis, it just gets worse. So you're dealing with a combination of things. So I stayed on metformin after that for a while. I couldn't tolerate it. My body, so it's always extra. Like acupuncture has saved my life. It has saved me from not having to be in more surgeries or anything more complex. But acupuncture here in the States is only really used for certain kind of things. So when you use it for this kind of women's health type of thing. I don't know how much they give, but I can tell you it has been night and day to have the right acupuncture treatment at different stages, to the point that I can tell you that certain symptoms have been completely healed for me just from acupuncture. And, you know, I think everybody's body is going to be different, but I had the pleasure actually recently in the last few years where I had a doctor actually back home in El Salvador who trained in Cuba. And he explained to me that over there, they give you a traditional medical doctor and they give you an acupuncturist to work with you alongside. And so he went to train there and he said, I saw about 60 patients a day because of the way they have their system set up. And then I'm like, so what's the difference what would you provide them differently there than you would in El Salvador or in any other country? He's like, well, the patient almost comes to see me every day. So then I said, well, how can we do it so I come every day? And that's what I did. And I even before then, I have seen other acupuncturists at different stages of my healing. And I can tell you, it's what it does to relaxing the body and however it all functions. I mean, I invite people to really learn about it in depth to see if it's something that they want to work through. It has really stabilized a lot of things in my body. And too many to count here right now, but I can tell you that is probably the one thing I stick to. And, you know, I take breaks from it because anything too long or prolonged, but it definitely feels better. And I always kind of know when my body feels like it needs something specifically to balance out. So, so there's actually been there's a couple of, I don't know if they're traditional studies, but there's definitely, I'll say case studies of some sort out there to talk about how women's periods do regulate. For me, it's been like, so for me, that's definitely one of them. Like that, it's like, I am full regular now. Like in my last few tests, everything came out like I don't have PCOS, even though there's certain things that still are there, like the major symptoms that I would have had, it just doesn't show anymore. The pain is gone. Completely gone. Endometriosis pain and all that. So there's just, so it's like I said to you at the beginning, the pain, the difficulties, the multiple surgeries, the part that is definitely apparent is like, I know what my body should be feeling like. When I finally figured out, I was like, oh my God, is this what normal people felt all these years in a period? Like I wasn't crazy. My experience was not normal, but this has definitely been helping me out to have a different experience. So I can tell you, it's like inflammation's gone down a lot. Still working on kind of the weight part. That's kind of the hardest part with the insulin resistance. But for the most part, everything else seems to be balancing out, and it's been for a couple years now. And it's not the only thing that I do. You know, I also make sure that I keep a lot of natural, organic products. I'm very mindful about making sure that I have a certain amount of protein on a day-to-day basis. I can always tell when I don't. The detoxing treatments are helpful because I can notice that my body doesn't always like release as it should. So, you know, even what are they call these lymphatic drainage massages are really good for that. And I've noticed that with a lot of PCOS women, it's just like and just when you're having women related health issues, many women, when I tell them, go try this out, see if you can do like B12 shots to like bring some of these balance to your body, like it really does help. And I think everybody's different. So you just got to test out with your practitioner what really works for you. But the supplements are necessary, and understanding that our bodies, for PCOS especially, have malabsorption of our minerals. So here I am eating everything that I think I'm supposed to, but I'm not. And like a recent example was I had a vitamin D high dosage treatment with one of my recent doctors. And they're like, hey, your vitamin D levels are probably really low. So let's just go ahead and work on that. I did. And this was like October, November. Come January, I'm working on another treatment here in the States. And then when I'm doing that, they're like, hey, your D is still really low. And I'm like, I just did a massive dosage. Like, I know I took it in. And so they're like, no, we're going to have you on for like 3 or 4 months more on vitamin D on high dosages. And then we'll go back to see how you're doing. And so it's really just finding the things that really work for you and how you're detoxing daily or as often as humanly possible. Have like a personal sauna at home, like the ones that you fold up and stuff. I was like, if that's what I need to do it, because exercise is not always the way. I trained to become a yoga trapeze instructor to like build the muscle strength and also to kind of really get grounded. There's a few other things that I'm doing that I'm going to start teaching. That's kind of, I was excited to hear to connect with you all because I want to find ways to connect with women to help them listen to their body, really build healthy boundaries, advocate for themselves, but also find different sources of how to, bring more balance to their bodies. I hope that anyone who's listening will take on from this conversation, if nothing else. Listen to yourself and advocate for yourself always. I think do your research. And I think, if you're not, and not everybody's in a place where they can be super resourceful to do that. And I understand that because sometimes I'll give people like, here are the 10 things you can do. And I'm like, you're just going to go off and do it. No, some people really need the hand holding. So I think you need to know where you're at. So I think that's the first thing. Do you need support? And is that support within your community? Is it your family, friends, someone that already can work you kind of with that baseline, especially if you just got diagnosed? That can help you do research, but also be mindful with you to don't go crazy with all the research that you're trying to do. So working with nutritionists who have background with PCOS or anything with women's reproductive health is critical. The testing your thyroid, there's different levels of them, and usually the regular test only tests one. Right now, I can't remember the specific of what they are, but make sure that you're testing all the levels of that. One thing I've learned from acupuncture is that doesn't matter what hormone is kind of wrong in your system, not working properly, you always want to work with your thyroid because it's the mother of all the hormone kind of process. So test and work through that one somehow because it may not be showing in your preliminary test, but there might be other things. I think also making sure that you have all the tests. I think that's the other thing too. Like, how are you doing all the blood work that you really should be doing? And if you're doing something like what's popular right now, like the semaglutide of Ozempic or anything like that, make sure you're not doing it on your own. Make sure that you're doing it with a provider that's going to help you see if you're actually doing what your body needs to do. Because there's the people who are taking it like, oh, I'm already, someone who my body functions well, but I just can't lose these 10 pounds. By taking it, they're going to lose it or lose more. We don't have that response. In fact, if you look at, I think it was the Miss Universe who was plus size and also had PCOS. She's shared publicly in her videos there where she's had some weeks and she's on Ozempic and she says, I've gained some weight. This is where we know our body's not naturally doing what it's supposed to. So if we have a week that we're off, we still have to be working with our providers. I hope that people listen to their bodies, and women, especially women, listen to your bodies. And I know we're so hard at this. Like, most women won't even go to the bathroom when they have to go. Your body will always signal you that something's off. So creating those spaces for yourself, thankfully, and all this madness, I started meditating when I was 11 years old. So I think that somehow all of those, creating those spaces for me, it was super helpful. At times when I'm not feeling my best, I've increased that. So I think from back then to now, it's just being more conscious of what my body needs or what my life needs is important. I think just where I'm at now is like I have a clear understanding of what my body needs. Sometimes it's not always the easiest thing to do. I have been able at different stages to lose a lot of weight. Maintaining it is a whole other story. The pandemic did not help. But one thing that shifted is just kind of how I've decided to take on the body work. So like training more, I physically can do it. So there's another thing about having PCOS, of being so tired or anything that has to do with your reproductive health. You just don't have the energy. So understanding when and how you can do that is important. And for me, it just has changed my life because it brought me back to what I loved, which was always being engaged in some form of the arts or being active somehow, but now in a way that I can do it healthy without impacting me, because there was a period there where I could be active, but then I could be out for the count for weeks. So now that doesn't happen anymore. But and then just with the part of advocacy is like, if you don't advocate for yourself, no one else will. There is not one other person who will do it. Not your husband, not your partner, not your family. No one will do that for you. They can try, but you're the one living in this body every day. So ensuring that you're the one speaking up for yourself or that you're finding the right support to make that happen is priority number one. If you're hearing this, if you see any of the symptoms, if you have any of those dark lines around here, if you're seeing sudden weight changes, up or down, loss, hair loss, facial hair, body hair, all of these things that are happening, you can look at the checklist. but really be conscious of like not ignoring the inflammation is a big thing. And inflammation is also very linked to our nervous system. If you're not sleeping enough, just pay attention to those things. You know, there's some normal things that our body should be doing. If it's not, ask the right questions, go find the right support, and don't take no for an answer.